With the evolutionary changes, the size of human brain or skull is increasing in size with respect to the jaw size. Also, modern diet, which needs lesser use of jaws, and this result into third molars, lateral incisors and canines to become vestigial. The technique of bone removal around the impacted teeth is the burr technique. The recent high-speed surgical handpiece, which does not give liquid spray and forced air, it is widely used for the removal of impacted teeth, and if you use a aerator for the same purpose, it can cause air emphysema which can travel to the lungs and it can be fatal. Patient is usually familiar with the experience of dental drills being used by the dentist in their mouth as compared to the rare use of chisel and mallet. So patient cooperates better with a handpiece. Also, the sound blows and the pressure of the mallet and chisel are all gone with the help of a handpiece. And now there is no need of an assistant to give blows on the mallet. When burr technique or surgical handpiece is used, it should be continuously washed with a saline or distilled water to cool the heat generated by friction between the bone and the drill. The operating area automatically gets washed and remains of any bony fragment, blood or saliva or other debris is also washed. Which technique is preferred? Cutting the tooth into pieces or cutting the bone? This question is generally asked while removing the third molar impaction as to which of the two technique is better. The first option is breaking the impacted tooth into several pieces and remove them one by one, which is known as odontectomy, without cutting or removing much of the bone, breaking the tooth into several pieces. Or the second option is removing much of the bone by ossisection with minimum damage to the tooth and thus removing the impacted tooth intact or with minimum pieces. So the answer to this question is, as far as possible, preserve the bone because it has to remain as a residual ridge. Tooth may be sectioned into as many pieces as required or needed because once it is extracted, it can be discarded. It hardly matters whether it is discarded in one piece or in multiple pieces. Nowadays, with the introduction of autoclavable air turbine handpieces and drills, which has a rotating speed of 3 lakh to 4 lakh RPM, it has become the method of choice for extraction. I have been using this waldent surgical handpiece for quite a long time, which I bought from Dentalkart. Actually, most of my clinic inventory is from Dentalkart. You can get a straight or a contra-angle handpiece based on your requirement and ease of use. I like it because of its quality and being the cheapest in the market. It comes with an air injection nozzle for constant irrigation with coolant, drip by IV drip. The first step of third molar impaction extraction is giving an incision and elevation of the flap. After we do incision and flap elevation, we remove the bone. So there is a saying, bone belongs to patient and tooth belongs to surgeon. Unnecessary bone removal must be avoided. For that we do guttering of the buccal bone. In this, a trough is created between the bone and the tooth on the buccal side. You can do it on the mesial or distal aspect if the bone is still not visible. Then we do the tooth sectioning, which is also known as odontectomy. The fragments can be removed easily one by one. We can section the crown from the root. You can also section or separate the cusp or separate the roots or perform any combination of the above. So splitting of the root is done better with the help of a burr and a surgical handpiece because we have control over splitting here. So we can individually section the parts with the different path of withdrawal, which can be removed easily with the help of an elevator. So in a curved root, elevator is to be applied on a convex side, but if you apply it on a concave side, it will force it against the bone and it can result into fracture of the root. And if it is still difficult to elevate, then you need to prepare a purchase point with the help of a burr, which is done at the most apical portion of the area of bone removal. Removal of the tooth or root doesn't complete the procedure until you do socket toilet. So the process of healing and after pain depends on the socket toilet. For that, you need to irrigate with the copious amount of normal saline in the socket and also irrigate to the apical portion of the flap where it joins with the bone, because it is a common place for debris collection. Incisions are closed with the help of suture. The last step is suturing. So it is easy to extract the impacted third molar when we do with a surgical handpiece, and therefore it is easier nowadays to remove a third molar. For this I use a handpiece, and this handpiece you can shop it from Dentalkart. You can also buy it online, for that which I have provided a link in the description box below. So this is about the third molar impaction. If you have enjoyed the video, give it a thumbs up, comment in the comment section below, subscribe if you haven't subscribed to the channel. Take care, all the best. I will see you soon in the next video.